For months now, I've been wondering why nobody in the news has been covering redundancies in the NHS. Most of the NHS has been under review. Anyone who's remotely senior as a nurse or a manager has been approached about the possibility of taking early or voluntary redundancy or early retirement. All the office jobs have been under review, with a clear view that half of them are probably going to go. There's even been a nice catchphrase for it in my trust. So there's a lot of story. There's a lot of news, and I've held off talking about it. I talked to a friend and said I was thinking of doing a video on it. But I don't work for the NHS, and they said, mass redundancies in the NHS? Oh no, there would have been a news story on it. Must just be a local issue. Well, it's not, is it? If you watch the news today, the story's finally broken. After about 4 months of radio silence, the media has suddenly discovered that tens of thousands of people are going to be made redundant from our beloved NHS. So the news has suddenly discovered that they can talk about negative elements of healthcare under Labour. I was very surprised last winter when there was no news articles, or I didn't see them, about people in corridors and waiting lists for A&E. Because every year there's stories about the shocking waiting lists in A&E. Or people sitting in beds in corridors. But last winter it seemed like the arrival of Labour had come like a messianic saviour for the NHS. No one was waiting in corridors anymore. Everything was great. It was back to the good old days. We've saved the NHS from those right-wing nutcases in the Conservative Party who all want to privatise it. The problem is there are waiting lists. And there are people sitting waiting in corridors. In fact, it's actually by design. It's not a mistake. It's part of the process. As the population has grown, the number of hospitals hasn't kept up, although we've added wards. By design, when people arrive in A&E, some people are streamed through to an urgent care centre, some people are streamed through to a bed, and a deliberate portion are streamed through to the corridor. They even have catchphrases for it. I won't say what it is, because I'm sure every trust has a different catchphrase. While much as we love the NHS, reform is needed. And even Labour can see that reform's needed. Maybe that's why they talk about the Reform Party so much. They never seem to be able to give a speech without mentioning Farage. Maybe they think he's got the solution. I doubt it, because very difficult decisions are needed to improve and modernise and streamline the NHS so that we don't reduce the quality of service, but we do get value for money for the money we spend on it. It's great that the news is covering the fact that 18,000 admin staff are being got rid of. What they aren't really covering is that there is an equal move to get rid of senior and middle-ranking clinical staff, people who actually treat patients. And also that, yes, some of those are purely administrative, but a lot of those people who go will be administrators who actually did healthcare, actually treated patients, and actually understand the challenge. Whereas one of the biggest problems facing the NHS is the number of very senior people who've never made a bed for a patient, probably never taken a temperature for a patient unless Aunt Mabel was sick. The spending cuts are surprisingly large. There's a lot of restructuring of departments where departments' entire role is being redefined. There's a lot of combining of departments. But none of this has really got any coverage. Just imagine if the Conservatives had made these reforms. Well, But doctors would have been out on strike about that, not about wanting even more money. The nurses would have been out on strike about that, or certainly their leadership would have. And the media would have been full of stories how people are going to die. No doubt some left-wing think tank would have come up with a statistic of how many people would die when they get rid of a member of staff in the NHS. Probably would have been as accurate as the number of people who die if the winter fuel duty was cancelled.